OptraScan is a Pune-based health tech startup that is making promising strides in the field of cancer detection and diagnosis. All of 27 years old, OptraScan co-founder Devika Gholap has been instrumental in leading OptraScan to become a pioneer in the early detection and diagnosis of this challenging disease. By way of advanced scanning capabilities, OptraScan is enhancing the accuracy and efficiency of cancer diagnosis, providing medical professionals with a more powerful resource to support their findings. We caught up with Devika as she shed more light on her passion for healthcare innovation and her relentless commitment to improving patient outcomes. Now, Devika, you've dedicated your young career to date to developing innovative solutions to help combat cancer. What ultimately inspired you to co-found OptraScan with your father, and what was the market gap perhaps that you were looking to bridge at the time?
Yeah, so I think there's a bit of personal touch to it, and of course a bit of sort of the market gap that we understood. Back in the day, so my grandmother, my father's mother, was diagnosed with cancer. And so this whole journey of OptraScan, I think, started at that point, because we had a really difficult time trying to pinpoint the exact diagnosis. You know, we went from doctor to doctor. Everyone had subjective opinions. And so it was a really difficult time for us. And at that time, you know, we both felt like there has to be a better way to do this. And that's when we started exploring this area. And, you know, everything in our lives still today is digital, right? I mean, our phones, our cameras, our cars, for example. But the only thing that's not been digital is a microscope. So it's a 250-year-old innovation. It has not been digitized since then. And so that's how we got, you know, started thinking about this as to why has no one touched this area? And, you know, there's so much scope to do something better in here.
Right. So at OptraScan, if you are in fact replacing traditional microscopes with digital pathology scanners and highly advanced ones, to what extent has your background in biomedical engineering or venture capital, for that matter, shaped your approach to entrepreneurship?
So it's actually really helped me in my entire journey, because one, biomedical engineering is, you know, in the healthcare space. So it taught me how to build products, how to make products, what goes in sort of creating a new innovation altogether. A lot of the education that, you know, what was focused on was sort of re-engineering products, breaking them down, putting them back together, seeing how sort of, you know, the puzzles fit together. And then my venture capital, or my MBA that I did, my business background also really helped me in identifying, you know, how do you identify what a good company is? How do you put in the money, you know, where you feel like it's going to grow? Essentially, how do you make money? And so, you know, managing your investment, managing your company versus managing the product. So how to build a product and how to build a business. And that's my venture and my engineering background that really helped me prepare for, you know, what entrepreneurship might be like.
Absolutely. It's very evident. And I know you've been named to the Forbes India 30 Under 30 list this year.
Yes.
We congratulate you. It's a huge honor.
Thank you so much.
But amidst all that recognition, what sometimes gets sidelined are the struggles. So walk us through some of the struggles that you faced in your journey, and do you perhaps continue to face them?
Yeah, so first of all, thank you so much. You know, being recognized as one of the 30 in the entire, you know, country as big as India is an absolute honor, especially when there's so many talented people. So, you know, I don't take this lightly. And, you know, every business or everything you do in life comes with its set of challenges, right? And I'm sure every other business owner will agree when I say that there's not one day where there's not, you know, issues that you have to deal with. And that's something I think I signed up for when I decided to pursue this path. You know, small things like, for example, you're competing with big established companies when it comes to putting your product out there. And these companies come with their gigantic, you know, manpower and resources, and you have to make sure to stand apart and stand out from that crowd.
Absolutely.
So that's a big challenge in itself with your limited resources that you have as a startup, right? Secondly, you know, you have to make sure that you're staying afloat as a company. There's employees that are, you know, relying on you for their day-to-day, you know, livelihood. And so you have to really make sure that what you're doing is, you know, it's for the betterment, not just of your customers, but all the employees as well. So you feel responsible yourself, and that's a big challenge when it comes to making sure that you're serving your employees as well as your customers. And then, I mean, third but not the least, I'm a woman in business, right? So you know that it comes with its own set of challenges. You know, it's not to say that I'm complaining about it. It's a part and parcel of, you know, the profession and the career I've chosen. Of course, times are changing. You know, things are becoming better, but it still comes with its set of challenges. So I think all of these are things that, you know, we sort of encounter day to day. But, you know, being recognized sort of makes up for all the issues that you face every day.
Absolutely. And OptraScan has, of course, recently closed a $30 million investment round by way of a Series B, right?
Yes.
So what are your short-term and your long-term goals for the company, and do you perhaps potentially foresee a public offering in the future?
So a lot of people ask me that, and I think, see, first of all, the fact that we received that investment is sort of a testament that not just us, but people outside are also recognizing and valuing our work, so much so that they're investing their money and sort of, putting their money in where they feel like, this is going to grow. So that that motivates us in a way. And in the short term, I think, so OptraScan as a company, we serve all over the world, right? Global customers. So we really want to use this investment to really grow and expand into more markets, because what I really feel like, our digital scanner essentially is a cost-effective model where we want to serve the emerging markets,
right,
where they don't have access to these technologies because they don't have the right kind of resources, capital to invest in them. So
sure,
with this investment, we really want to target those new markets, expand into those existing markets as well, and really reach to those people and tell them that, look, we have a solution for you because we have gone through similar issues. We know where, what the challenges are, and we're here to serve you. So short term, this is it. We really want to sort of reach where, we couldn't earlier.
Right.
Long term, I keep on saying this, that long-term goal is to replace every single microscope out there in the world with our scanner, because I think it's really high time that microscopes are digitized. We bring in sort of a more fact-centric, data-centric approach to pathology, because see, pathology is the first step in healthcare decisions, right? Because say your doctor tells you to go and get a biopsy done, and then the pathologist is where they'll tell you what kind of cancer you have or what stage it is at, and that dictates your entire healthcare journey going forward, what treatments you take, surgeries, medication, lifestyle. And so you want to make sure that, like, at that initial stage, you're getting the right kind of diagnosis and outcome and treatment, and
right,
even consultation. And that's why, we feel like we're at a age and space where we can really make a lot of impact on people at that initial healthcare journey. So yeah, with this funding that we have, I think I hope that we'll be really able to reach a lot more people and just do a lot more good.
Very heartening to hear, and lofty goals ahead, clearly. Now, when you think about the digital pathology space, which is of course rapidly evolving, what are some of the transformations that perhaps take you by surprise or excite you the most, keep you up at night?
So, it's really surprising that, of course, you can expect developed countries like the US, adopt this much more quickly, and they've seen digital pathology for a long time, so they know what it is. But I think what really makes me happy is that the most curiosity and excitement about this comes from the emerging markets. It comes from, areas where there are, the population is high, but they just don't have the resources, but they know what is good for them, what is right for them. Sometimes, like, I don't like saying this, but sometimes, we have to tell the Western world that, look, this is good for you, whereas emerging markets are like, we know this is good for us, tell us how we can, adapt it. And so this is where sort of the one high level thing that, has really pleasantly surprised me. And I think one other trend that I see coming up a lot more, I think it's a little bit advanced for where we are in the digital pathology space, but so in pathology, when you're staining the slides, you use like chemical reagents.
Right.
Now people are, and that's something OptraScan has been pioneering, is that we're moving away from chemical reagents. We're doing everything digitally, virtually.
Sure.
So a lot of AI-based diagnosis, treatment outcomes are based on this. And so sort of high level, high-tech technology like virtual staining, where it's extremely machine learning and artificial intelligence based outcomes. And I think it's a testament to the fact that there is, so much of scope in this space. It's not just digitizing the microscope, but it's also the software applications going forward. And, you're treating a few cancers now, but you're developing algorithms for, there's so many cancer indications to treat,
sure,
so much to do. So it's just the fact that, there's a nice, clear road ahead. There's sort of, you start from a specific few sets of cancer indications, and there's so much you can expand on, and I think that's just what excites me about this space.
It's time for a short break, but our conversation with the co-founder and Chief Product Officer of OptraScan, Devika Gholap, continues on the other side, so stay with us.